Hello everyone, I hope you all are doing well. My name is Kashyap Rastan. I am a doctor by profession currently working in CGHS Jammu, and I welcome you all to our channel Doctor Simplified. Before starting the main video for today, I want to share a small story of my own. It was around March 2023 when one of my close friends and my batchmate introduced me to some exam which is called Combined Medical Services. He told me that it is a brilliant exam. You get a government job and you get all the benefits. You get the home, you get the car, and all the facilities and the gazetted post as well. So I got very intrigued. I tried finding it out. I asked my seniors, but hardly anybody knew about this exam. As we all know, the awareness is supremely low for this exam. And I thought after that I would just focus on clearing this exam, and later on we will decide if we want to continue or not. And I very fortunately cleared this exam back in 2023, and today it's going to be around 1 year of my service. I joined in March 2024, and today we are standing at February 2025. So I think I'm capable enough now to introduce you all to what this combined medical services exam is. This is for the aspirants who are preparing for UPSC CMS 2025 but do not know much about the exam itself. I think it is very important to know what you are preparing for before starting your preparation. So let me tell you what all is this exam for, what all you get after you clear this exam. It's a brief orientation for all of you. So as we said, what are you preparing for? I have jotted down in a point wise form so that it gets easier to understand for all of us. The first point is it is a medical officer post exam. Medical officer, which is a permanent job. Remember, a lot of candidates ask that the jobs are temporary. No, it is a permanent job exam. Medical officer post. It comes under the central government, Ministry of Health and Family Welfare. I come under that. And level 10, the starting scale itself is level 10 with the basic pay of 56,100 rupees. That is a lot, trust me, because you get a lot of allowances along with that. Second point is it is a job and not a course. A lot of people tell that the exposure is very less and you get to learn very less compared to what you do in MD or MS. My simple answer to all of that is it is not MD or MS. It is not your course which you are going to follow. It is a job which you are going to do. If you go to any of the specialists who are working in the corporate hospitals, I have experienced it myself. A lot of orthopedicians who are working in the top private or corporate hospitals in my own state, Jammu and Kashmir, they encounter around 80 to 90% cases of osteoarthritis. They give the same medicines, D3, vitamin D3 supplements, calcium supplements, painkiller, or a muscle relaxant. A lot of them do that, and similar is the case with internal medicine who are physicians practicing in the corporate hospitals. I see a lot of them prescribing medications for diabetes itself. A lot of patient load is for that. So a job is different from a course. In a course you see a wide spectrum of cases. The same may not be possible for a job. It is also a job and not a course. Please remember that there is a difference. Now let's come to the third point. You have two categories within this exam. There is category 1, which is CGHS. The full form is Central Government Health Scheme, and category 2, which caters for railways, MCD, the Municipal Corporation of Delhi, and the NDMC, and there are other cadres as well, such as Port Health Officers and Ministry of Labour. A large chunk of vacancies is filled up by CGHS, railways, and MCD itself. Other cadres have very few posts, and there are other minor cadres as well, which are equally important. Now let's come to the salary part. The salary part is the starting basic salary is basic pay. The BP here is basic pay, so it is 56,100. It is on par with any of the IAS IPS officers. All of them level 10 have a basic pay of 56,100 rupees. You get other allowances as well, which includes a dearness allowance, which is used to combat with the ongoing inflation. There is HRA, house rental allowance. There is transportation allowance. There is something called as annual allowance, and last but not the least, there is non-practicing allowance or NPA. So NPA can be beneficial for a lot of people, and this could be a disadvantage for them as well. Why do I say that? The government gives you money to not practice outside. So you get money to not practice, to not put on more working hours, but at the same time you do get money to not practice. There is a difference. It could be a disadvantage for the people who want to practice outside and who want to legally practice outside, I would say. So it gets disadvantage for them. But yes, we have to follow what is under our legal sanctions. We have to follow that. You do get NPA and you cannot practice outside legally. There are deductions as you get the salary. For example, my basic pay now has increased. I would tell you how it is increased as well. So in my 1 year of service, the DA has been increased. So 3%, 3%, twice in a year DA is increased. And basic pay is also increased. My basic pay right now is around 57,500 rupees. So it also gets revised every year. You can consider your salary to be increased around 10 to 12,000 rupees per year. We will talk about the 8th pay commission in the later part of this video. Stay tuned. So here comes the deductions, which I don't think a lot of us would like. So the first is NPS. We know that you get to contribute something to something which is called as NPS. The government also contributes and you get a corpus towards the end of your retirement. So which is under the new pension scheme. There is also something which is called as income tax. So income tax is deducted every month from your salary, and towards the end of the year, financial year, you have to contact your CA and get everything done regarding the income tax returns and everything. My most favorite deduction is the CGHS itself. CGHS is Central Government Health Scheme. Just remember, it is kind of an insurance for all the central government employees, which includes all of your tests, all of your medicines, all of your procedures. Everything is covered up by the government. As I have mentioned, it is a health insurance which covers you and your family. You and your spouse would be covered. Your children are also covered. There is certain terms and conditions for that, and your parents can also be covered, but there are certain terms and conditions for it. So your family and you are covered, which includes all the medicines, investigations and procedures, which are either free of cost or you can get them reimbursed or claim them back, and the money is credited in your account later on. That is there. And there are certain miscellaneous deductions also. So this is what the deductions are all about. So trust me, CGHS, this deduction is very, very good. Now let me talk about the work timings. For myself, CGHS, the work timing is from 7:30 a.m. in the morning to 2 p.m. in the afternoon. There are only OPD cases. There are few places which have night duties, and the post duty is usually off, and night duties are not that hectic also. This is more commonly in the central Delhi region, where you get to attend some night call patients as well. So yes, the work is pretty hectic. I would definitely say that it is not an easy job. 7:30 to 2 p.m. every day I see around or more than 100 patients, and though it is only OPD, it is pretty hectic. And what about the holidays? All the central government holidays or the gazetted holidays you get, and trust me, holidays are a lot. You get around 8 CLs every year, 30 earned leaves every year. There is half pay leaves also. You get leaves for your during your delivery time, especially for the females, you get that also. So you do not need to worry about the leaves as such. You just need to apply, and your leave is credited by your in charge or the additional director itself. So the work timings are pretty chill, but the work is pretty hectic. About the MCD, we have talked to an MCD doctor. You can check out the video about the interview, and you will get to know what are the timings in MCD and other benefits and other things which an government doctor employed under MCD has to do. Now let us talk about the promotions, which are really really good. So the fifth point is about promotions which are automatic. Automatic means time bound, which is also called as DACP, dynamic assured career progression. That is, I got employed, it is going to be around 1 year of my service. Around 5 years of your service, you get promoted automatically to your SMO, senior medical officer. 4 years after being the SMO, you become the CMO, chief medical officer, and after some a few years of it, you get higher administrative posts, that is NFSG, then senior administrative grade, and later on I think the highest is the HAG, high administrative grade itself. So the promotions, at least in the initial half, like 5 years and 4 years, these are automatic. Your career progression is assured, so you get timely promotions in them, and there is increase in your pay levels, and everything is also increased. Now in the higher post, you get more administrative role. This is specifically for the people who are restricted to MBBS, like who have just done MBBS. They get higher administrative roles, like you are more put into the administrative part as you become the senior, because if you are a postgraduate, I'm sure you would like to work in your specialty oriented job. So all the specialists, they tend to move towards the central government hospitals in their own specialty and would like to work in them. So the administrative role there is less, and clinical role there is more. But if you are for example, if I continue to be an MBBS and I continue in my service regularly, I can later on become the additional director or the director itself, director of CGHS. So this is regarding the increments and the promotions. Let us come to the exam part. I am briefly discussing about the exam here. I'm not going into the detail because this is just for the orientation. The later details about the exam part we are going to discuss in the subsequent videos, and we are going to post videos very frequently and cater to all of your necessities. The exam part, the written exam is of 500 marks, 250 plus 250, that is paper 1 and paper 2, 250 marks each, and it has around 120 questions, so you can understand around 2.08 marks for each question. Paper 1 consists of general medicine, around 90 to 95 questions come from it, and pediatrics, around 25 to 30 questions you can estimate comes from pediatrics. Paper 2 is general surgery, obs and gynae, and PSM. Equal weightage you can consider, and the paper is very theoretical. There is no image, black and white paper booklet you are provided with it, and you have to fill up the OMR sheet. There is also one doubt, that is it an exam of computer based test or something? No, it is an OMR sheet based exam, and you have to fill up the OMR sheet and submit it. And let's talk about the interview. Interview is usually of 100 marks, but trust me, it is very very important to give the best shot of your interview. Now let us come to one of the doubts which actually one of my college mates asked me. He told me that I am focusing more towards the post graduation, but along whenever I'm going to get the college allotted for my post graduation, for the time pass I want to join CGHS or some cadre, and I would work till then, get money, and I would go into the post graduation. It does not happen like that, because in my case, I would take my case itself. The written exam was conducted in July. The interview was conducted in October and November. Mine was in early October itself, and I got allotment. I got my place of posting under CGHS in March 2024. So from July to March, it itself is 9 to 10 months. So it is a long process, and I think a lot of people would have already joined post graduation by then, like it happened for this year. The allotments are, if I'm sure that allotments are not yet out, but still many people have already joined their post graduation courses. So it is a very very long process. So don't think that it's just you will just get some money and you can quit and go into the post graduation, because allotment is late. Coming to the probation period. The probation period is of 2 years, and after this you get your tag of a permanent job. So yes, you have to clear the probation, and you continue with your service. Now let us come to the recent developments, which a lot of employees working under CGHS, the doctors and other staff members under central government, are also waiting, and I'm sure you would also be looking forward to. That is the 8th pay commission. In 8th pay commission, your basic salary is going to increase a lot, and automatically you can expect around 15 to 20% raise in your salary. It could be more, it could be a bit less. I don't think it is going to be less. It would be on the higher edge itself. So you can expect a good amount of increment in your 8th pay commission. And if I will be honest to all of you, I think getting 1.2 lakh, like it is for me, 1.2 lakh as an MBBS graduate is a big deal. You do not get this much money working as an MBBS graduate. I still remember when I was preparing for this exam, I was staying in PG in Bangalore, and I had to get the rent and other groceries and whatever the cost is, I had to live it up. And I used to do some duties, locum duties, and they used to pay me 2000 rupees per duty. And I still remember I used to work, and later on they used to dump, and they did not used to, nobody likes to pay money. So I had to fight a lot to get that money itself. The salary as an MBBS graduate is very very less. One of my beloved seniors told me that in Delhi he used to work and he used to get 60-70,000 rupees as an MBBS per month. And later on, when he moved on to some other corporate hospital, they told them, why would I pay you 60,000 when I can get Ayurvedic doctors for 25,000? I'm not going to waste money. So this is the reality. I know there is very very tough competition for the MBBS graduates to get a very good job and very high paying job with great work life balance. So this is what it is. As an MBBS graduate itself, 1.2 lakh is a very big deal. In metro cities like Delhi, Bangalore, it is even more, Mumbai also. And it goes around 1.3 lakh or 1.4 lakh, I'm not very sure of, in metro cities, because the HRA is more. So it is a very good deal. And so yes, 8th pay commission salary is going to be increased, so congratulations. Second is the gazette notification. I will definitely make a video regarding it. There is a recent development that gazette notification regarding CMS candidates who can apply for assistant professor or professor posts in government hospitals. What is this regarding? We will discuss it in another video. So now the second point, which is a very recent advancement, is a notification which is regarding CMS candidates applying for assistant professor or professor posts in the government hospitals. Before this notification, there used to be it was a very big task for the CMS candidates, specifically for the CGHS doctors, to work at these posts such as AP or professor or associate professors. Because it used to be difficult. Once in 3 or 4 years it used to happen, those interviews used to happen, and we used to get allotted these posts. But now there is a new notification which has made it easier for us to work at such posts in the central government hospitals. We will talk about it in great detail, but for now we will stick to this. So it is easier for you as well to work as an AP or professor. Now when to consider and when not to consider giving UPSC CMS. You should definitely give this exam. To join or not join, it comes by the pros and cons. Let me tell you about the pros first. It is a central government job. Central government job, you should be proud of yourself. It is very tough now to get a central government job. So yes, you should be proud of yourself. There is good salary, as I have discussed with you before. 1.2 lakh starting is not less. Getting in hand 1 lakh is not less as an MBBS itself. Third is the fixed working hours. As we have discussed in CGHS, it is 7:30 to 2. Your work is hectic, but timing is pretty chill, right? So that is the case. Fourth point is it has a great work life balance. You get to live your life. You can go on trips. You get a lot of holidays. You can officially go on trips. You आपको बहाने मारने की ज़रूरत नहीं है, and you enjoy your life, learn new skills. I'm trying to start this YouTube channel and try to cater which I did not find during my time. So yes, great work life balance. Fifth point is minimum work exploitation. There is hardly any work exploitation. You get equal respect. You respect, you give, and you take equal respect. So yes, minimum work exploitation. You understand the healthcare sector much better. Trust me, your understanding of how the hospitals work, how the government in terms of the health sector, how it works, you get to know about it. And with time, as you go into the service more deeply and you get very higher posts, you understand them. Your depth of understanding increases eventually and exponentially. So yes, this point is very true. Now let us come to the cons. It is a longer path. Definitely it is a longer path. It is not like you get your MD MS degree, you apply for post and you start working as a specialist. You have to wait. If you join after MBBS, you have to wait for 3 to 5 years of your regular service in order to pursue your higher education. So automatically things get delayed in your life in terms of career progression. Second point is clinical learning is less. It is subjective to each and own. You can understand from each of the patient who is coming to you. You can learn from each and every patient, and you can thrive on each and every patient and treat them according to yourself. There is no there is no obligation that you are not allowed to treat. So it is up to you. Third point is definitely true that you do not get andha paisa. There is a fixed salary, there are deductions, and your salary increases. Your salary is very decent, but there is no andha paisa. You are not going to become a billionaire and or everything if you continue to be in this service. So, and fourth point, which is also subjective, that no private practice. Either you can enjoy your life, or you can rant about you are not allowed to practice outside your working hours legally, but private practice is strictly not allowed in CMS, central government job, because you get your non-practicing allowance. After all of this, I think to a lot of extent I would have catered your doubts. Thank you, and kindly stay tuned to the channel Dr. Simplified. We are going to make a lot of videos for the CMS 2025 candidates, and in general videos also about this exam. We will discuss a lot. If you have any doubts, anything, you can discuss them in the comments section. We would reply to all the doubts, and I would also try to make a separate video of the doubts as well. So thank you so much, and stay tuned with Dr. Simplified.